For 4 minutes.
I thank the chair, and I'd now like to yield to my friend from Florida for purposes of a colloquy.
Gentleman.
I have heard from my governor, state officials, providers about
the challenges on the ground in Florida and what they're facing. The demographic issues in Florida raise significant challenges for the state of Florida, and it's in the Medicaid program, particularly the state Medicaid program that provides cost covering the elderly and the most disadvantaged in nursing home program, as well as the rising costs associated with Florida's aging population. As the process moves forward, Florida's unique challenges must be recognized and accounted for as we relocate dollars and reallocate dollars for this important safety net program.
I thank the gentleman from Florida not only raising this issue, but being a real partner in this legislation. I've met with your governor as well, who has been very helpful in the discussions. We believe that accounting for aging demographics of the Medicaid program and broader population is an important factor we must consider to ensure that any Medicaid reform is successfully implemented. I'm committed to working with you, the gentleman from Florida, our colleagues in the Senate, and the Trump administration to ensure Florida's unique challenges related to an aging Medicaid demographic are recognized and accounted for appropriately.
Thank you, Chairman. Thank you.
Mr. Speaker, in the remaining part of my time, I'd just like to thank my colleagues for their work on this measure. Making sure that people have access to affordable health care is essential. It's something I would say we all care about. We all care about family members who have suffered from cancer or other debilitating diseases or afflictions. We're trying to find a place here that works for all Americans, where we have insurance markets that are actually available, where you can get an insurance product that works for you, that's affordable for you. We know that today in America, the insurance market and the individual market, that's a very small segment, 7% of insurance in America. That's what we're talking about here today, that market is collapsing before our eyes. In fact, in Iowa, I think they just announced 94 and 99 counties. People there won't even have an insurance product they can try to purchase on the exchange. We've met with governors, we've met with insurers, we've said, what do we need to do to intercede to get this market back to where it works? The proposals contained in our legislation are designed to do exactly that, to get back to where consumers have choices when they're required to buy insurance, to take care of their families. Those choices need to be affordable. They are not now today. My own state of Oregon, premiums have gone up 50% in the last 2 years. And meanwhile, the number of options you have to choose from has gone down and continues to go down. Now, we haven't gone as far as where you have either no option in most areas of the state or just one. But how far off is it when insurers are failing, people losing their opportunity to get affordable health insurance? We take care of the disabled. We take care of the elderly. In fact, we plus up to medical CPI +1 to make sure we take care of the elderly and the disabled in our Medicaid program. By the way, that is probably more than most states are spending today. So we have thought this through carefully. We care about people and their medical condition and their families because we're all in this together as Americans. And I think the bill we have before us today works. It works to take care of those most in need. It works to make sure that the people can get access to insurance. And I'll tell you what, it is a first step in a many-step process to also look at families who are dealing with opioid addiction and what we can do there. There are efforts at NIH, which we just supported yesterday, to fund medical research so that we can get to cures for those who have diseases and other afflictions. We are fully committed to improving health care not only for Americans, but around the globe through innovation and scientific discovery. And with that, I yield back the balance of my time.